When you're looking for a first medical job in Australia, you want to make sure that there are opportunities, meaning you are not waiting for a long time to find your first job. And there's also a component of stability. That means that you are able to have a stable career progression, not meaning to look for jobs every 6 months to 12 months. Now, emergency medicine trainees' pre-tax salary is between $120,000 to up to $150,000. Consultants earn between $300,000 to up to $500,000, that is Australian dollars per annum. In this video, I'm going to talk about who should join the training in emergency medicine, a specialist assessment in emergency medicine, junior doctors who are considering training into emergency medicine, how the training looks like, and where to look for jobs in emergency medicine. Finally, I'll lay out my conclusion based on all of these factors. So without further ado, let's jump right into it. So who should join training in emergency medicine? There are two types of doctor who must think of emergency medicine training. First, who want to join critical care specialties like anesthesia, ICU, emergency medicine, and I would say that even general practice, as the skills and the knowledge in emergency medicine training are directly related to all of these specialties. The second type of doctors who are not quite decided on specialization but prefer acute care, procedurals, and won't mind a shift work which provides them with flexibility in their personal life. A year of work in emergency also gives refinement in resuscitation and procedural skills. And if you later want to join medical, surgical, pediatrics, ONG, there's a good exposure to all of these cases in areas in emergency, both from the acute and resuscitation point of view, and also not so acute in fast track and subacute areas. Also, the specialists who want to subspecialize in the area like toxicology, hyperbaric medicine, pediatric emergency medicine, ultrasound, medical education, especially simulation, Australian emergency medicine training programs offer plenty of resources and training opportunities in these specific areas. In addition to substantive training in the UK, plus passing of FRChem exam or other emergency medicine training programs like FCPS from Pakistan, MD from India, Saudi board from Gulf countries have all been accepted by Emergency Medicine College here in Australia, either with an outcome of partial comparability or even substantial comparability. However, the emphasis here is how to compare your training, skills, and exams during the application and interview process. A well-done application can save you years of further training and could even prevent your postgraduate training and passing the exam from failing the assessment as non-comparable. Now, as of this video timing, the MR Chem and other diplomas are not yet recognized for specialist assessment. Now, we've helped number of EM consultants from overseas getting successful comparability outcome. So please contact us info@emergencyfocus.net if you need help in this area. Joining the emergency medicine training program is perhaps the simplest of all training program in Australia. Basic criteria is general APRA registration, that is after passing AMC 1 and completion of AMC 2 or WPA program and 12 months of Australian medical training experience. You must be in third year of your postgraduate training, meaning after passing the MBBS, you must have completed 12 months of internship plus 1 RMO year level experience. You would require structured references from 2 supervisors in an Australian emergency and focusing on key areas like clinical capabilities, teamwork, and especially the communication skills and your readiness that you would be not only able to commit to a specialist level training program, but also complete the training program here in Australia. Now, components and duration of training. The FASM training program consists of 5 years of structured training, and it's divided into provisional training and advanced training. The provisional training is for 12 months, and trainees work in emergency department under supervision, developing foundation skills in emergency medicine. Now, advanced training is for 48 months. It involves training stage 1, core emergency medicine training stage 2, which includes non-ED placements such as anesthesia or intensive care or broadened critical care skills. Training stage 3 involves core emergency medicine training, critical care training, and completion of procedural skills which are set out in the program. Pediatric emergency medicine exposure also happen in this stage, as you know, this is 25% of your workload anyway. Training stage 4, the final advanced training, includes elective training, more complex procedural requirement, and preparation of fellowship exams. Critical care, ICU, anesthesia, and pediatric requirements are 6 months of critical care training, which is either ICU or anesthesia or related field. Pediatrics training, which must be met, is specific pediatric requirement are that you must be working in a specific pediatric emergency medicine requirement, or plus you can also work in a ward setting, making sure that you have ticked off enough category and complexity and acuity of the cases. So a combination of bit of work in both pediatric emergency medicine or bit of ward work would suit you just fine. In training assessment, now the major part of emergency medicine training in Australia is in training assessment. The FACEM program emphasizes regular assessment throughout the training to ensure continuous development. These include shift reports, which are assessment by shift supervisor on clinical performance, case-based discussion, which are in-depth evaluation of your clinical reasoning and decision-making during the patient care. And they are actually quite complex, meaning that they focus both on the clinical and the social element of patient care. Direct observation of procedural skills, or DOPS. These are the real-time assessment of specific procedural skills. For example, your intubation, your central line placement, your arterial line placement, procedural skills or procedural sedation. This may even involve chest tube insertion, plus any procedure can be counted towards it. They are broadly categorized as airway, breathing, and circulation procedures. Mini clinical evaluation exercises, or mini key access, focused clinical assessment involved interactions with the patient in an emergency department. Now, there is a research, or what we call 410 project requirements. Now, it's been very popularly known as 410 project because it was a clause in the whole of the clauses of emergency medicine training program, and this must be completed before the sitting of the final fellowship exam. You can also do the subjects like biostats or epidemiology or evidence-based medicine from a university. I know examinations are tough. FACEM trainees undergo 2 major examinations during the training. Primary exam, usually taken in the stage 1 or TS1, and it assesses knowledge and foundation in medical sciences such as anatomy, physiology, pathology. And these are both the component of MCQ and also the Viva component. Now, all of these subjects need to be taken simultaneously. The fellowship exam. Now, I can say a lot, and there's actually a video in my channel covering how to prepare for the emergency medicine fellowship exam. So here I'm going to only cover it briefly. There are 2 components: the written component, which can be taken during this training stage 3 or TS3, and includes multiple choice question and short answer question covering emergency medicine knowledge in all the core subjects: medicine, surgery, pediatrics, critical care, anesthesia. There are a list which goes on and on. And the preferred book is Tintinelli or Rosen. Clinical exam, which is OSCE, taken during the training stage 4 after the completion of the training requirement. It involves practical scenario using simulated patients and clinical station. Lots of communication going on. You might be, counseling a patient. You might be taking a consent for a particular procedure, or you might even be, breaking a bad news or demonstrating a teaching. So it is a lot which is going on these OSCE station. Now, I would also like to highlight another thing called EM diploma and certificate programs for trainees who do not pass the fellowship exam or choose to exit the FACEM program for personal reasons. Alternatives are available, and these include emergency medicine certificate, that is EMC, and diploma programs. And these could be particularly good for the doctors who later want to join the GP pathway, and these programs would give them the additional skills which would let them work more independently as a GP VMO. Means better salary. Now, where to look out for jobs? The options are our website, Emergency Focus. We can help you if you send us an email, info@emergencyfocus.net. You can also jump onto state recruitment website and locum agencies, because there are plenty of jobs. Everybody is able to help, but I think what you need is a job which can professionally help you develop and keep you in that stable area for the duration of time. Now, for junior overseas doctor wanting to join the emergency medicine training, my advice would be to focus on finding any first job in Australia. This could be emergency medicine, general medicine, pediatric, or ICU job. And they are commonly advertised on New South Wales, Victoria, Queensland, WA, South Australia, Tasmania, Western Australia, Canberra, all of the state recruitment government website. They can also be found on Seek and Indeed, but I do find those websites to be a bit more cluttery and might not be very easy to dig it out on the first instance. For specialist, however, I would suggest to try all of the above that I've suggested, but also to contact us, because we would be able to help not only finding the job, but also help with your application and interview for the college, which we have done previously with a great degree of success. Since my 20 years here in Australia, I've only seen the demand for emergency medicine grow in Australia. The training numbers have steadily increased and more jobs exist for specialists in both VMO and permanent consultant roles. Employers are able to sponsor visas for the international medical graduate and provide good incentive to relocate to regional and even rural areas to take up these jobs. From an IMG perspective, this might perhaps be the only field which provides good opportunities and job stability wherever you choose to work in Australia. But also, if you ever wish to leave Australia and relocate to any other country, Australian emergency medicine training program is well recognized in the UK, Canada, Singapore, Malaysia, Middle East, India, Pakistan, and many other countries where you can directly work as a consultant without undertaking further training and exams. But not only that, I would say that emergency medicine work actually provides a well-balanced work life. Well, as long as you're able to bear with the shift work. Look after yourself and each other, and I'll catch you in the next video.